Hello, everyone. In this section, I'll be covering paradoxical gout flares and how to prevent them in the first place. So what are paradoxical gout flares? So both allopurinol and febuxostat initiation and dose up titration can be associated with a short-term increase in the risk of gout flares, which we term paradoxical gout flares. The reasoning behind this is that when you have a rapid decrease in the serum urate concentration, you have stable monosodium urate crystal deposits that can resolubilize and precipitate again. This represents a fresh exposure of these crystals to the immune system and can then precipitate an acute gout flare. For this reason, gout flare prophylaxis is recommended for those starting any sort of urate-lowering therapy, whether that be allopurinol or febuxostat. And the duration of gout flare prophylaxis is recommended for 3 months after urate-lowering therapy initiation or after each dose increase. There are 2 medication options available for gout flare prophylaxis in this trial. Colchicine is the preferred agent, and naproxen is considered second line. These medications should be taken daily, even in the absence of flare symptoms, because the whole purpose is to prevent a gout flare in the first place. If a subject develops gout flares despite taking one of these medications regularly, they should follow the instructions outlined as a part of their gout flare management plan. So a couple of words on colchicine, which again is the preferred agent. For subjects who have an estimated GFR of greater than or equal to 60, the standard starting dose is 0.6 milligrams once daily. There are a couple options included. So you have the option to increase to 0.6 milligrams twice daily for those with breakthrough flares. Or alternatively, you can decrease the dose to 0.6 milligrams every other day for those experiencing GI tolerance, which I mentioned is usually the most common and the first side effect of colchicine to appear. There's a slightly different dosing recommendation for patients with some degree of renal dysfunction. So with estimated GFR of 45 to 59 or stage 3A CKD. Again, the standard dose is 0.6 milligrams once daily. Most subjects should be able to tolerate this dose with this degree of renal dysfunction. However, you do have the option to decrease to 0.6 milligrams every other day, again for those experiencing GI intolerance. However, in this subset of patients, colchicine twice daily dosing is not allowed in patients with stage 3A CKD. And this differs a little bit from the gout flare, the acute gout flare treatment, because that is a very short-term use of colchicine twice daily, whereas this would be at least for 3 months. The other medication for gout flare prophylaxis is naproxen. Again, this is less preferred than colchicine, but is an option that is available. For subjects with normal renal function or estimated GFR of greater than or equal to 60, the standard dose of naproxen is 250 milligrams twice daily. So still a twice a daily dosing, but at a reduced dose than for acute gout flares. You do have an option here also to increase to the higher, more anti-inflammatory dosing of 500 milligrams twice daily for those experiencing breakthrough gout flares. However, naproxen should not be used chronically for gout flare prophylaxis in subjects who have stage 3A CKD. In other words, if someone has an estimated GFR of 45 to 59, their only option for gout flare prophylaxis would be colchicine. Thank you.